Hi everyone, you're welcome back again for another session of abuse and how to prevent it. The first session, we talked about the different types of abuse. We talked about the the indicators, that is how to know when someone is being abused, the signs to look for. Then we talked about how to get them help, how to respond to the uh, abuse, how to teach them. I taught them how to respond to someone that is being abused. We talked about immediate response to safety, if the person needs to be safe at that time, if it requires safety. Then we talked about immediate care. If they need care at that time, if we see them soiled, we see them hungry, we see them looking tattered, we can provide immediate care. And we talked about medical assistance. If we see that they are bleeding from their bruises or wounds, we can give immediate assistance or help them get medical, take them to where they can get medical assistance. And we can give them emotional support, and we continue to arrange for ongoing emotional and physical support and care if they need that. We talked about all that. Today we are going to talk about how to prevent abuse so that it doesn't even occur. So we really need the seniors to hear this, to listen to this, because if you know how to, if the abuse is being prevented, it won't even happen at all. The first thing I will advise is to stay connected. Stay connected to other seniors, stay connected to the community, stay connected to your neighbors, church members, whatever uh, social community you belong to. Stay connected. Do not isolate yourself, because the abuser will always want to isolate you. We always want you isolated so that they can continue to do what they are doing. Then you need to build a supportive relationship. We need to help them to build a supportive relationship. We need to teach them how to build a supportive relationship. Then we need to, they need to be aware, because awareness is power. Aware on how to use technology, like I talked about the 1-800 number. They need to know how to use the phone, know how to dial when they need help, know who to call, know where to call, how to use technology safely. If you don't know, learn. Like in uh, some of the workshop past, we were taught about how to avoid scams, how to use technology safely. And we equally learned how to be financially literate. There was a workshop on that. I would advise that maybe anyone that needs it, just let us know. We'll replay it for you, and how to avoid scam too, because you can be scammed. You can be scammed. And again, know your rights. Know your rights, because if you don't know your right, the abuse is going to continue. There's Elder Abuse Prevention Ontario. There's Ontario Human Rights Commission. So you need to know your rights. Another big thing is assertiveness training. You need to be assertive. Confidence, respectful in expressing your needs, your opinion, and setting your boundaries. You need to know all this. If you know all this, you're going to be empowered. Then you know what to do at the right time. If you don't know, it's good, the abuse and whatever is going on is going to continue. The first step in the assertiveness is you need to understand what assertiveness is. You need to understand what it means to be assertive. You need to be confident, respectful in expressing your need, opinion, and boundaries. And for you to do that, you need to understand your own character too. Sit down and study yourself. What do I need? Who am I? What are the things that you value? Your feelings, your motives, your desires, your communication style. Are you the one that is very quiet, calm, or are you a little aggressive? So when you know all that, you now know how to work on yourself, because you need to work on yourself too. Then you need to know your communication style. Learn what is socially appropriate. Behavior for self-expression of feelings, attitude, wishes, opinion, and rights. Know how to rightly communicate. Then you need to learn skill training too. You need to know specific verbal and non-verbal behaviors. Anxiety reduction, that is how to reduce your anxiety when it's building up, cognitive restructuring. You need to know all this. And practical session too. Get involved. If you don't like, there are community centers where all these things are being taught. If you don't know, you ask. Like we do a lot of programs that can help you know all this. You get involved with practical sections, modeling behavior, rehearsal, systematic feedback and coaching. When you're doing it, let's get feedbacks. How am I doing? Am I doing well? If you're given assignments to be done, make sure you do it. Do your homeworks. You'll be getting trained every time, every day. When you do your skill, you get involved in real life practice. Extend your new skill now into real life situation. Wherever you have been taught in your assertiveness training, put them into practice. Put them into your real life situations, and any progress you are doing, let them know. The next thing is implementing change. How do we implement change? Now that we have known types of abuse, we have known type of abuse, we have known the indicators, how to watch out for the indicators, the signs to watch out for, to know when an elder is being abused or not. Now we talked about immediate help that we can render to somebody that is being abused, that need help immediately, where to direct them to. If we are not in the position to give the help they need, we'll know how to direct them and where to direct them. And we have equally talked about the number to call when somebody is in immediate danger. And in prevention, now, which is the second topic, we talked about staying connected. We talked about building supportive relationships. We talked about one, not isolating themselves. We talked about being aware. We talked about awareness, being power. We talked about how using technology safely, which is another workshop that has been taught before. If you need to know more about that, I can talk to the organizers so that they will play it for you again. How to avoid scams, learn how to learn how to be financially literate, because we need to know all this. Because if you don't, when you are being defrauded, you will not know. And we talked about know your right too. If you know your right, that is the only way you will know when you are being violated. Then we talked about assertiveness, you being confident and being respectful in expressing your needs, opinion, and boundaries too. And we talked about steps of being assertive, assertive trainings. So now we're going to talk about implementing change. In implementing change, I'm talking about promoting public awareness campaign. We need to talk about it. Launching campaign to raise awareness about abuse and available support, because a lot of people being abused, they don't even know that they are being abused. They will just keep quiet, but when they know that they are being abused, then they will seek for help. We let them know that there is help there for them. There is help there, that they should not just stay being abused because elderly spouse too, they abuse each other. And caregivers abuse elders in their homes and all. So they need to know. We need to educate the public on recognizing abuse signs and seeking help, just like according to Ranawat et al. 2022. He said we should educate the public on recognizing abuse signs on people because they may not want to speak up. But when we see those signs in them, we talk to them, we let them know that it's not right. Sometimes they don't even know that it's not right. They think that is life because probably that is what they have known. We have to educate them and let them know that that is not right, that is wrong. Then to implement change, we need to develop cultural sensitive counseling too, because the culture comes into play too. Because some culture, they will tell them, oh, especially women, you cannot talk, whatever, or some people, they will say, whatever is going on in the family, you cannot discuss it outside. Even when they are killing you there, you keep quiet. No, we have to let them know that that is wrong. Now we have to integrate cultural competence into counseling practices, know their culture, let them know what is wrong in that too, and the right things there and the wrong things there. And again, offering language support and translation services. There are some people that don't speak English, so that even when they are being abused, they don't know how to say it. They are speaking their language, the person they are talking to do not understand. So we should try, we'll try and be offering language support and translation services. It should be available for people to tap into, because it's not everybody that speak English. And another thing, another way we can implement change is advocacy for policy and legal reforms. That is, with the government, will lobby for stronger legal protection for abuse victims, because this is one of the reasons why they don't want to speak out. They are afraid that they are not going to have protection. When they speak out, the person abusing them is going to abuse them more. We should let them know that there is a protection for them, and we should lobby for more so that the victims are well protected. And again, we should lobby for promoting policies that funds counseling services, because counseling is very expensive. A lot of people cannot afford it, and it's not everything that is being paid for. So if there are funded counseling services, then the people that need it will be able to uh, gain from it. Another way we can implement change is we let us read journals on successful implementations. We review successful community intervention case studies. We know how some cases has been solved. By knowing that and reading about that, we'll know how we'll help people with similar problems too, and know how we're going to help them. Then we adopt best practice from model programming and initiatives too. We need to read about best practice model program and initiatives for us uh, to be able to help those that need the help. And all this we're talking about, there are uh, barriers too. There are a lot of barriers. There are a lot of barriers uh, to overcome in this in helping those that are being abused. Like we talked about language barrier, we talked about not enough funds, we talked about not enough free counselings. Those are all barriers. That is why a lot of them don't speak up, because they are afraid. They are afraid if they speak up and the person they are staying with kick them out, where are they going to stay? What are they going to do? So there are a lot of barriers, and we are going to talk about overcoming these. We're going to talk about these barriers and overcoming these barriers in the next section. Thank you so much. Thank you for listening today, and have yourself a great day. Bye for now. Yes. Before we go to the next before we get to the next workshop, I just want to talk about the priorities of nursing implications in this preventing abuse. Like if in the hospital, an elderly is brought to the hospital for care or for assessment, as a nurse, you should lead the effort for improved counseling access. You should be able to uh, get the elderly connected to where they can get counseling, because you are the one that assessed the elder or the patient, now a patient to you. You know the best way. You have assessed the patient. You see the patient, the elder now, which is your patient. You have seen that the abuse indication is there. So you are the one that should conduct a good screening and assessment to detect the kind of abuse the patient is going through, and provide immediate care. And you need to link the victim to resources to where they can get help, because when they come to the hospital, it's very likely that it is you they are going to see. You are the one that will do the screening and assessment. So you should be able to detect the uh, abuse and link them to immediate care and resources they need. And I'm going to talk about importance for the nursing profession here. They need to enhance patient trust and safety training. Need to undergo how to earn patient trust and safety, to promote comprehensive care and patient advocacy. Because when we see them, we should be able to advocate for them. Well, and as a nurse, we should lead effort to improve counseling access, because they might not know that they need counseling, because it is very hard to get healed without counseling. And we need to engage in policy development and community outreach. We cannot just stay in the hospital and believe that they will come and meet us there. We should engage in development and community outreach too. We should be able to go to the community where we live. There should be funding for that, not just staying in the hospital. Go to community center, go around your community, know what is going on there. Read about case studies, the cases that has been successful, the interventions that have been successful, how it was solved, what happened, how it was handled. Some of hospital-based domestic violence programs, we can attend that, partner with a local shelter, support organization. As nurses should be able to go out there, reach out to shelters. There should be funding for all that, for nurses to be able to go around, because they have the skill to assess and know what is really going on. And I say thank you today for everything, for listening. We're going to talk about the barrier to uh, the barrier to resolution in the next workshop, because whatever we are doing equally have barriers. Thank you, and have yourself a great evening. We started the classroom as you already began. We sure about this that we will overcome, and the shall become.